Okay. So let's dive right in. I wonder if you could each address what you see as some of the myths around eating disorders at midlife.
Well, first of all, I think the fact that eating disorders occur in midlife, I know when I was diagnosed in my 40s with anorexia, I had the same preconceived notions that so many people have. I was like, how could I possibly have an eating disorder? I'm in my 40s, I eat, I'm a mother of three, busy, whatever. So I think the biggest myth is that eating disorders can't happen to anyone other than young adolescent women. And the fact is, eating disorders do not discriminate. They impact people of all genders, all ages, all body types. If you're a human being, you can develop an eating disorder. So I myself had so much to learn when I was first diagnosed in midlife. And there are so many people, I think, still that think that it's impossible to develop an eating disorder at this stage.
I second that. I think that most people don't even identify that they have an eating disorder. So we really don't know how many people are out there that are struggling. I know in my private practice, I've started with people for other reasons. And as I talk to them, I'm like, oh my God, I think you have an eating disorder. And that's not why they came to me at all. So I think that many people don't recognize that they even have a diagnosable illness in middle age. Some people grow into it, but some people are really, and we'll talk a little bit more about why we think so many people are struggling. But I think it's really many more than we know. Absolutely.
I mean, you think about all the stuff that's out there in popular media, right? It all seems to be focused on people that are typically in their 20s, maybe 30s and teens.
Mm-hmm.
And so when you two think about that, how would you say eating disorders in midlife maybe present differently from other areas of the lifespan? And what might some special considerations be when you think about that?
Do you want me to?
They both point to each other.
I saw that.
You go first.
Yeah, I think that people have this perception that they should be settled in life, that you've kind of gotten to where you need to go by middle age. And so and actually I think it's very true with a lot of people where you get settled and the perception is that you have a great life. You might have a great marriage, you might be in a relationship, you might have a family. So how could you ever not be okay with all of these things? And actually, I think that a lot of people are not okay with those things and then don't know how to express it and do express it through their bodies. And we live in a very toxic environment. I've told this story before, but I have a lot of friends in my community and they know that, they talking about diet, talking about their bodies is not acceptable to me. But if they didn't have me there, they would probably be talking about it a lot more, right? Because that's a very normal conversation for middle-aged people to be talking about. And I, you kind of are observer when you go out in public and hear these conversations, you're like, oh my God. So I just think that I think we have to break the image that it's one type of person. It's just not. I mean, it's the same with socioeconomic issues that people think it's, still people that have financial resources that have eating disorders. It's so not true. So I don't think it's just about middle age. I think it's about everything, that anybody at any point can struggle. And I think as we talk more about the reasons why people in middle age may even begin having an eating disorder, it'll make more sense. So
I'd say that when we talk about eating disorders in midlife, there are a few different categories that they typically fall into. And I see this a lot with the work I do. I do a lot of peer support through groups and mentorship. There are those that have struggled their whole lives and don't know anything different. They can't even envision a life in recovery or without an eating disorder. It is so embedded in their identity and who they are in their life. There are others who struggled at the more typical ages in adolescence and young adulthood. And then for a variety of reasons I will talk about, typical triggers in midlife, relapse at some point, and have to go through the experience all over again, having enjoyed a period of recovery. And then there's those like myself who was diagnosed for the very first time in midlife. But I will tell you, for many years, my eating was certainly disordered. I was a D1 college athlete and nationally ranked tennis player. I definitely did not have a healthy relationship with food and exercise, but I just attributed it to being an athlete. So even though my eating disorder wasn't diagnosed till I was in my 40s, for the very first time, and sort of the perfect storm happened at that time that led to a clinical diagnosis, there's no question that my eating and relationship with exercise was certainly disordered for many years before that.
You had mentioned when you were talking, there's life transitions that can trigger an eating disorder. What do you both see as the typical transitions, or what are some of the transitions that might trigger one?
I think it's true for any gender, but particularly a time when if you've chosen to have children and your children are moving on, I find that to be the most, even I get chills as I say it, the most profound time where people are like, who am I? What is my identity? What do I want in the rest of my life? And it's really, that is when I feel like it really hits hard. Um, just about life transitions, like, where do I go from here? Am I too dependent on my children? What if my children are not as connected as I'd like? What do I want to do? I work with a lot of people who have not had careers in their lives, because they chose to not work because they were able to. And then suddenly it's terrifying. I work with somebody now that is like, where do I go from here? So I think there's a lot of fear about those next stages. And I mean, we haven't even begun talking about the body changes and for, like and also I'm going to keep on saying this word. We just live in the most toxic environment where we can fix everything. And, I mean, I have somebody that's just hit 30 that's she just did her teeth, she's doing her lips, she's doing her, this and that. It just goes on and on. And so, can you imagine being in your 40s, 50s, and 60s and living and trying to kind of compare yourself to whatever people 10, 20 years younger than you? So,
Just to build on what you said, I think some of the common factors that can trigger an eating disorder in midlife are definitely associated with dealing with the aging body and the fact that our bodies are going to change no matter what, and trying to hold on to youth or whatever, especially living in this toxic diet culture. A lot of women I've worked with have been athletes and remember how they were and have a really hard time that their body is changing, that they're no longer having the same athletic body they once had. There's a lot of women that see a change in their relationship, their marital status, the loss of a partner, aging parents, the empty nest. If your whole identity has been raising children and then you did that, now what? So there's a lot of things that happen at this stage in life that differ from those who are younger and struggle with an eating disorder. Those are some of the typical, the changing body, the aging process, the change in relationships, and the loss of important people.
and the other thing is, as you get older, you're starting to look at, I'm sorry to say, death and dying issues. So it's not just my body's changing, but where do I want to be and how, I work with a lot of older people now because I'm older. So it seems to have happened naturally. People like, a lot of older people don't want to work with somebody that's 20 or 30 because they're 75 or 80 and they're like, I want to do the work. And they're starting to really deal with some very, very tough issues that are not talked about enough.
Yeah.
And so that's another stage of that a lot of people go through. So
I want to revisit the body changes with all of us for a moment because there are so many of them that you deal with in midlife, and it was certainly after you've had children if you're female. When you think about the messaging, right, that we get in whether it's social media or magazines, there is this thing about the fountain of youth, whether that's through surgeries or cosmetic procedures that you were pointing out. There's a comment for you that I'd love for you to also comment on in how you kind of navigate that with clients or people that you're working with, as well as if you actually see relief. So one is whenever we do trainings at Meta, we're always talking about the fact that a human body is designed to change, right? From the time you come out of the womb, we're not all meant to stay our birth weights. Fun fact.
Yeah.
A body that is not changing is what? Dead.
yeah.
Oh, right. So yet we have this really strong message of we all need to look like we're 17, apparently. Do you actually see physical interventions and cosmetic interventions changing anything for people? Does it actually fix an eating disorder that's developed? Is it actually shifting how people feel about their bodies? Does it make it go away? Because I know there are people that have that question.
I'll just comment and I haven't had a ton of experience with this because I haven't had a lot of people come to me with cosmetic changes. But I think it does, I don't think it changes their relationship with their eating disorder. It may make them feel differently about how they move around in the world. If you get a facial or something like that, I do feel like people feel like they fit in more, particularly if you're living in a culture of people that are all doing that. One of the things that I noticed the other day, because I was with a group of my friends and all of us are aging. And we all, I don't think anybody I know has had work done. But then I go in different environments and everybody's had work done. So I think it depends on what community you're in. And yeah, if I was with Betsy and she's had her eyes lifted and all those things you can do and had all the lines done. Yeah. But if I was with her all the time, I probably would think about it more. Right. So I just think it's the kind of environment you're living in that will promote it. Does it stop the eating disorder? No, I don't think it does. But I think it's just people may feel differently and about how they're managing their friend group in the world if they're deciding to date again, all of those things.
Follow up to that.
Yeah.
That makes sense. And is it your experience, or do you think that those procedures are helping people avoid dealing with the inevitable fact that they're aging? Because when they look in the mirror, they no longer look their age. So is that a way of not dealing with the fact that we are getting older?
Yeah, I think it is. I try to be not judgmental about what people do. I've had to work on that a lot. From the time people started getting, stomach surgery, that was a big controversial thing. And then now with all the medication for weight loss and with doing something different to your body.
Yeah.
I've had to work as a therapist about not like really working hard at not being judgmental about those things. So I don't really know what happens to people, but I think they feel like I work with some people who feel like they're just going to keep doing it to feel better.
Honestly, the reason that I asked is it made me wonder if more and more people have access and the ability to change their body, whether that's faceless or whatever. And exactly, people have autonomy, can do what you like with your body. But will we down the road start seeing more and more eating disorders in the elderly as a result? Because at some point,
It's not enough.
And I
It's
think
never enough.
you absolutely have to address what's inside, no matter what. And I tend to focus more on embracing aging. And yes, it's human to miss your youth or how you once looked. But for me, the focus is on getting to age is truly a gift. I lost both my parents at very young ages to cancer. I've outlived them both. So that's given me a different perspective, just appreciating health, and recognizing, and I say this to my groups and people I work with all the time, we're only given one body and we need to take care of it. And it's a gift. And when we shift the focus from what our bodies look like to what our bodies are able to do when they're healthy, I think that's just such a powerful reminder that this is the one body we get, so we better take care of it. And the other thing I focus on is that you can't tell by looking at someone whether they're healthy or not. Health comes in all shapes and sizes. And someone in a larger body could be much healthier than someone in this thin ideal body that society portrays. So that's just sort of my perspective based on my own personal experiences, that getting to age is a blessing and a gift, and focusing more on what's inside and what our body, if you think about what our bodies do for us over the course of every given day, we just take for granted everything we do from the time we wake up till the time we go to sleep is pretty remarkable. And so I try and make the focus beyond that. It's inevitable. Our bodies are going to change. I also always say, if you lined up 10 people exactly the same height, their bodies are all going to be different. They could all eat and exercise exactly the same. Their bodies are still going to be different. So our bodies have a set point where they want to be. And aging is part of life. Just like, when preteens go through puberty, as we age, our bodies are going to change. So learning to accept it. And when we have a hard time accepting it, I think there's usually something else going on that needs to be addressed. But it's hard given the society. I'm not saying it's easy, but given the society we're living in and the toxic diet culture, it's hard.
One of the things you said, I just want to emphasize that I think the clinical work is to help people deal with the aging process. And if you really help them work on that, then there may be less need for the eating disorders. But it's a very, very challenging process because our world does not really support people getting older. Our culture doesn't.
I wanted to actually also bring in disability and chronic illness into the conversation because it tends to rise at middle age, right? So when we talk about the bodies that we're given, some people are born with disabilities, some people have lived with disabled bodies their entire life. Are you seeing more eating disorders in that subcategory of folks with like chronic illness, right? Or autoimmune disease, physical disabilities, and eating disorders as a way of potentially mitigating emotions around that?
I am in my clinical practice. I work with, but again, one of the problems is that everybody's so quick to look at weight loss medication for somebody dealing with any medical issue.
Yeah.
I mean, it's quick. I have a family member that's lived in a larger body her whole life, and finally, she's accepting that this is the body she's meant to live in, and it's been wonderful, and um and everybody still tells her to go on medication. She's like, I'm not, why do you keep on asking me? I'm not going to do that. And yes, does she have some limitations? She's on her second hip surgery. She's had some stuff, which then people are like, okay, then this'll, get you to not have that. She's like, I'm finally accepting this is the body I'm meant to live in. So
I'll just say my chronic illness that I was diagnosed with in my 40s was part of the perfect storm that led to my diagnosis of anorexia. I had always been very healthy physically, an athlete. I definitely had suffered from significant anxiety that wasn't diagnosed till around this time. But in my early 40s, I was diagnosed with moderate to severe asthma. In fact, if I start coughing tonight, that's why. I should always wear a sign saying I'm not sick. I have asthma. But when I was diagnosed with asthma, I barely ever even took Advil for a headache. And now all of a sudden I had to learn to manage a chronic illness that would require daily medication. I had many serious flare-ups. It increased my anxiety, which ultimately led to its diagnosis. Turns out the anxiety goes back to young childhood, but my asthma made me feel so out of control, so anxious. My eating disorder sort of took hold as a way to feel more in control when the asthma made me feel so out of control. Obviously, I learned in recovery that it was the eating disorder that was in control, not me. But having to navigate a brand new chronic illness at that stage in my life, it wasn't the only factor that contributed to my eating disorder, but it was a significant factor. I would go into what I would call these asthma funks when I could barely get off the couch because I was so short of breath. And I couldn't at that point just accept that this is an illness. I'm going to have to learn to manage it. As someone with anxiety, I wanted it to be black or white. You take this and then you're fine. I had such a hard time with managing, different dosages or different medications, or not being able to do what was expected of me, not knowing how to rest when my body was telling me it desperately needed rest. So being diagnosed with a chronic illness for the first time in my 40s was a huge contributing factor to my eating disorder.
And add to that people with multiple chronic illnesses that then are on their own. So you're dealing with the fear of how will I ever be able to manage? Like, what is going to happen in my life? And again, when you're younger, you might have the level of support. Your parents might still be alive, all those things. As you get older, you don't have as much support. And then everybody's getting older, which is one of the challenges of getting older. As you get older, it's like, well, I need help. Well, everybody's older than you, so it's tricky. It's tricky, but it's the out of control feeling. Is this sounding depressing to everybody? I'm sorry. It's like, oh, I actually love being older. Personally,
It'll be more uplifting shortly. But I think it's helpful, right, for people to be able to identify those triggers that can happen. And when you think about the amount of change that happens at midlife, it's huge. There's certainly changes in bodies throughout the lifespan, but there isn't, I don't think, another portion of the lifespan where you're often navigating things like you had mentioned. Your kids are leaving, your identity is shifting because you're no longer Bobby or Sue's mom, which is, I don't think anybody knew my name after my kid was born, right? And now all of a sudden you get your name back and you don't know who you are. Maybe your relationships, people are navigating more divorce at midlife than other parts. Your health is shifting. For folks who might be supporters who are listening and they may not understand why an eating disorder would be so compelling, I can imagine, and I've heard it, I know you have as well, folks saying, but if you have all this stuff going on, why wouldn't you want to eat well? Do you want to speak just briefly to how eating disorders help people through emotional difficulties?
Yes. Definitely speaking from personal experience, not only did my eating disorder take hold when I was struggling to manage a chronic illness for the first time, and also my eating disorder took hold as a way to reduce this incredible level of anxiety that, again, it wasn't diagnosed till I was in my 40s. And that goes back to your original about co-occurring conditions here. I had anxiety since I was a young child. How do I know this? Because before I wrote my memoir, I read through all these childhood diaries and saw so many examples of things that I said and thought as a child. It was like putting together this puzzle of my own life and seeing how all the pieces fit together, and seeing that my anxiety, which I thought, here it is in my 40s, actually went back to when I was a young child. But I think that so many people in midlife, and of course I'm generalizing, I think we're so busy caring for others and focusing on others' needs. I know for me, my eating disorder, another reason it really took hold was because for decades I literally internalized any and all emotions. I'd never been given permission to feel or express negative affect in any way. I grew up feeling like I had to be the perfect good girl and meet everybody else's expectations. So I think in midlife, often we don't recognize when we're busy taking care of others that we actually have needs of our own, and that self-care isn't selfish. So I learned so many things in my recovery journey, in my 40s and early 50s, that if I had known some of these things, decades earlier, it would have prevented a lot of anguish and a lot of turmoil. Understanding that, it's like on a plane, put your own oxygen mask on first before the child. We have to take care of ourselves, but we're so busy being caregivers, But if we focus on the fact that we can't really care for others until we care for ourselves first, but so many, and I'm speaking for women because that's, the population I tend to work with, our eating disorder has a protective value. It helps us feel in control when life circumstances and factors are making us feel out of control, and it's this false sense of security, something that you can control when life situations are making you feel out of control. Or for someone like me, I didn't know it was okay to grieve after both my parents died very young from cancer. I thought I was supposed to just be grateful for the positive. So again, my eating disorder helped numb all those emotions. But when this perfect storm hit, all of a sudden I learned that I was going to have to let my guard down, be vulnerable, talk about these difficult experiences. So I think talking about eating disorders in midlife, it's all eating disorders are very complex psychiatric illnesses with obviously a variety of causes and triggers, and treatment requires, a interdisciplinary team. But I think so many women in midlife are struggling without realizing that they're struggling because they're so focused on either their careers or their caregiving or their responsibilities. It's not about them until the medical and psychiatric crisis really hits, and all of a sudden they have to find out what's really going on. I don't know if that answers your
Yeah.
question, but I think there's no simple, it's very complex. And often there's a multitude of factors at play.
My thought is for across the spectrum of eating disorders, they work. I'm sorry, they work until they don't. It doesn't mean that life is good, but they do the job they're supposed to do. And I think we need, as supporters of people, we need to remember that and have empathy for why it exists and why it has come into someone's life. In midlife and beyond, if somebody's had an eating disorder for so long, they know nothing else, right? And so to ask somebody to shift and to be focused only on that rather than what their life is like, I think is the wrong message to give people. I was with somebody today who I think it was again a client of mine who never came in with an acknowledged eating disorder, but clearly they're struggling. And I said, well, I happen to really know this stuff. By the way, like, would you like to work on this? And I've been working with this person for a while. And this person said, no, I'd really like to work on my smoking. I was like, okay, like, that's like, I get it.
Okay.
You take one thing at a time, and so when you've struggled for your whole life, I think we as providers have kind of too much expectation. I mean, I believe in people can recover, but we have to have patience and understand why this this is helping them in some ways.
And it's never just one factor.
Yeah.
There's always something else going on. But I think people who are supporting those who are struggling, um, especially people in midlife, partners or family members, understanding that sometimes the person who's struggling can't explain how you can be supportive. I know there are many times my husband would be like, I feel like the worst husband in the world. I don't know how to support you. But when I was consumed by the eating disorder thoughts, I didn't know how to let him in. I didn't know how to help him help me. So learning as much as you can about eating disorders and what's going on, so you can understand that one, your loved one didn't choose this illness, and it always has a complex, uh, so many complexities to the eating disorder. It's not as simple as you just need to know this and then this. And also knowing that this is there's no quick fix. You're in this for the long haul. And when the eating disorder takes over, the loved one can feel like they've lost the person that they know, and just having that patience and understanding that your loved one didn't choose this, and that the process to recover is going to be difficult, and it's not going to be linear. And I just think understanding the illness is the best way we can help people help us.
The other thing I'd say is from what I would try to do with a loved one is say, I always ask the loved ones, what have they struggled with in their lives that has been hard? And can they make that connection? Because I think people separate eating disorder. Oh, you have an eating disorder, especially in midlife. It's like, well, that's kind of weird. It's like, well, wait, whoa, 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 whoa. Like what else? Is there anything in your life that you've been through that has been hard to shift? And really help them understand from a different perspective what their kind of their expectations are of their loved ones. So
I love that you both actually brought up the fact that there are positives that do come. I'm not selling an eating disorder to anybody
Yeah.
listening. I have to say that when I train people too, but there are so many ways in which it helps someone cope with a life that feels really unmanageable. And so they're powerful in that. We also know, we both have actually spoken briefly, or you've mentioned it, that it's really rare that somebody just has an eating disorder. We know that 90 to 95% of folks who have eating disorders have co-occurring illnesses. What are the most common ones that you're seeing at midlife?
I'm seeing a lot of depression and anxiety, a ton of people who have lived with it for years and years and years. I mean, I see a lot. I see some OCD, but more depression, anxiety, and again, a fear of what's coming in their lives, which is a different type of anxiety and depression, like how a lot of people in their 60s, 70s, and 80s are like, what is the next? What is going to happen? I have somebody who I work with who's scared of dying in her house alone, right? And so it's like, how am I going to manage that? What do I have to do? I have to make these changes, but I don't want to make those changes. And so just, I think it's a natural, normal anxiety, but it's been building for a long time. And again, I don't think our society supports older people trying to figure this out, navigate it. Just like I think that, there are many populations I don't think are supported. I think one of the reasons I don't think we support parents of adolescents enough. I mean, there are many populations that, people are just not honest enough with how they really are coping. Everybody wants to have a good light on everything, and it's tough, but there are tough decisions to make. So
I definitely say anxiety and depression, anxiety in many different forms. For me, it was anxiety connected to anything health or safety related. It still is, except now it's recognized and managed. Whereas looking back, I spent my whole life so tightly wound, anxious about anything having to do with health and safety. But it wasn't until that perfect storm and the asthma diagnosis in my 40s that led to the diagnosis of anxiety and the eating disorder. It all sort of I always say my eating disorder was the culmination of so many different challenges, but it became the catalyst for healing.
I'm going to say one more thing. I think that people also who are even fully recovered need to be cautious throughout their lives. So I'm just putting that out there that you can relapse, and I don't mean at any time, but that it's, because as you're going through a different stage of life, you have to be pretty careful. And I think the thing I find is when people relapse is when they're not accepting or admitting that they need the support and the help because they're so shamed by it. And so I think opening up that conversation and knowing that people can go for help, that, it makes good sense why somebody might go through a relapse at different stages of their life. And the idea is to catch it, to get the support you need and, move on. So,
And I think it's focusing on the fact that recovery is almost never linear, and that it's actually normal and very common to have setbacks, step sideways, backwards, or full blown relapse. And in my groups, we talk a lot about those setbacks or relapses as a learning moment, an opportunity to sort of stop and look and say, what is really going on right now? What is it that I really need? And also taking away that shame, which is so prevalent with midlife eating disorders, recognizing that, you know what, I may be struggling right now and I need some extra help and support, and there should be no shame in asking for help. But the key is asking for help before that relapse or setback really gets out of control. But when talking about fully recovered, I also talk about how so many people, like I know plenty of people who are fully recovered from their eating disorder, have never heard that eating disorder voice ever again. And when people ask me what I think about like in recovery, recovered, all that, I like to say my recovery is very strong. It's been many years since I engaged in any eating disorder behaviors, but I'd be lying if I said I never hear that eating disorder voice. And I'd say the difference is now it's a whisper, it may be a reminder, and I can easily disobey, disregard, but it doesn't mean I don't hear from it. And my own therapist never talked about there being a finish line to recovery. In fact, it's on my bracelet, the quote she shared with me. It's an FDR quote, and I share this every time I speak. A smooth sea never made a skilled sailor, and recovery is about becoming a better sailor, because recovery, no matter how wonderful it is, it's not all sunshine and rainbows. Life is always going to present challenges, stressors, especially as we age and changing relationships. So recovery is about learning ways of coping with these stressors and challenges that don't involve behaviors with food and exercise. And we can always become a better sailor and learn coping skills like reaching out for support, admitting that we're struggling, being vulnerable, letting our guard down. So I don't even, is there a finish line? Maybe for some people, but I think the reality is there's always a chance of relapse, but having that self-awareness and understand in what your own personal needs are and what support you're surrounded with, I think is really important.
I think sometimes too, when people are talking about eating disorder recovery, regardless of where you are in the lifespan, many times we're focused on the specific behaviors that go along with the eating disorder, right? But really, recovery encompasses so much more than just the behaviors. And so we're on this kind of lifelong transformational journey in emotional health and healing. So I love how you just kind of encapsulated that, especially with the FDR quote. That was beautiful. I wonder if both of you could also speak a little bit to what is particularly challenging about identifying folks in midlife, or identifying the eating disorder for folks in midlife, and also what some of the barriers are to getting treatment at midlife. Beth is already smiling.
I will say everyone who comes to me, whether it's I do run virtual groups for women in midlife, they come to me because they have an eating disorder at this stage. They may fall into any of those categories that we talked about, either always have had it or relapsed or were diagnosed for the first time. And often they're referred by their therapist or dietitian or word of mouth. So I'm not the one making the diagnosis when they come to me. They have an eating disorder. My in-person group is all ages and all different stages of recovery. So that's a whole different, people in their 20s up through their 70s, and they all support one another. So, but I hear from, I'd say women mostly, from around the world. I put my email in the back of my book, and I'm so glad I did, because I get emails all the time, literally from around the world. Most recent one was from a woman in the UK who's ready to give up, and hopefully I'm keeping her from doing that just by emailing back and forth. But I hear two things. One, I hear those who did finally have the courage to seek treatment at a higher level of care, they leave prematurely because they feel like everyone there is the age of their own children, and they find it impossible to focus on their own recovery and instead become sort of the mom figure for everybody else in treatment. And I had a woman in my in-person group recently. She's older than I am, and she just returned from several months in residential care and is in such a better place. I'm so proud of her. But her words were, she was so ready to leave because everybody was, half her age and then some. She talked about surrendering to the process. And I think when an older person goes to a higher level of care, they really need to do that because it's so easy to use the age of the other clients as a reason. Oh, I can't relate to them. They can't relate to me, and put up those walls. I can't possibly get help here, and too often leave prematurely. But if they can sort of surrender to the process that they belong there too, and yes, they may be older than most of the people, but they're there for their own recovery and focus on what they need. I also hear from so many people in midlife that the biggest barrier to their getting treatment, besides the typical ones of there's no place nearby or whatever, is just the demands in their life, either children at home, a demanding career, caring for aging parents. They can't focus on themselves and their own needs and their own recovery because they're too busy taking care of anyone else, of everyone else in their lives, not recognizing that that it's okay if they prioritize their recovery, and even if they have to leave their family or their job for a short period of time to get the help they need and deserve. It's actually a gift that they can give those in their lives. But logistically, financially, there are so many reasons for women. And again, it's men too. I just tend to say women because I work with women, but and speak about women. So many do not feel that they can leave their responsibilities to seek the treatment that they need and deserve. So many go without, and it just perpetuates the eating disorder, which has become so ingrained in a way of life, not recognizing that there is another way if only they could get the help they need and deserve.
I thought about this a lot before this presentation. I mean, we really need a facility that specializes in older people. We really do. And I think that there's a need for it. I think that there are different conversations to be having. Um, and I think that my experience when I was consulting to some treatment programs is the younger people get scared of the older people, right? They're like, like, oh my God. And or the older people are mentoring the younger people and they're not taking care of themselves or thinking about, because it's a great distraction. Oh my God, I'm 55 and I have a 25-year-old roommate. I'm going to be like wonderful to that person. I'm just going to help them through it. It's like, but what about you? So I think that there are real problems with merging the ages as much as we do. And there are specific issues I think that older people need to address that are not talked about enough in treatment programs. So even a smaller, a 6 or 8 bed treatment program that would be a delightful thing in this world we're living in. So
People don't have those fears or
yeah,
excuses if they know they're going to be cared for where they
I would
are in their lives.
not want to go into a treatment program where, and you can never, no treatment program, because I've had a lot of older people ask and they're like, well, first of all, there might be somebody that's your age, but they might leave within 2 more days. So I'm left with, being 55 years old with, 18 to 25-year-olds. That's not a good look for, how I'm going to heal. And I agree with you, Betsy, that yes, you want to make the most of it, right? Of course. But it's hard. It's really, really hard to make that connection and feel like the issues that you are dealing with. Plus, in most of the treatment programs, there aren't staff that relate enough to that population. So again, are you going to get someone that's 55 or 60 talking to a 30-year-old clinician? And again, I am not, it can be a wonderful relationship. I'm not saying it couldn't be, but it still makes it that much harder.
I'm thinking about how ingrained caretaking behaviors tend to be, right? And in anybody that has an eating disorder. So it makes so much sense that folks in midlife at higher levels of care would struggle in particular to try to even figure out where those boundaries are.
Yeah.
But also not everybody has access, right? like not everybody can go to a higher level of care. So are there resources that the two of you are aware of that could be really helpful for folks in midlife who either think they might have an eating disorder, know they have one, maybe don't have access to the higher levels of care, whether there are or are not midlife folks there? Where would you point folks to?
To your group.
Um, well, I think there are virtual options out there now. There are treatment programs that are exclusively virtual. There are others that have a virtual option. And whether it's individual therapy, work with a dietitian, the option of telehealth. I think there's enough flexible clinicians out there that, someone has a full-time demanding career and can only see someone in the evening. There's someone out there that will see them in the evening. It may not be easy to access that. I think it's also hard, and an issue that needs to be considered is that older person admitting that they need help in the first place. I think there's a lot of denial and a lot of shame. So the first step is acknowledging and admitting that you need help. It's okay to seek help. I offer peer support. Like I said, I'm a lawyer by education. I'm not a licensed therapist or dietitian, but the reason I'm so passionate about peer support and why it seems to be helpful for people in this stage is it's that extra support between those professional appointments. And I won't take anyone who is not under the care of a licensed clinician, ideally both a therapist and dietitian, but it's okay if they just have one, and medically stable. And I can be that extra support, someone who gets it, someone who understands some of the things that someone without an eating disorder doesn't understand. We always talk about challenges, we talk about glimmers. And often they're things that if you share them with someone outside the eating disorder space, they'd be like, oh, great, you did that. Wonderful. I do that every day. But being with people in the same age range who understand the struggles and understand that we need to celebrate the wins as well. I like being that person that is there to provide that extra support, because it is so isolating at times between those professional appointments. I had the most incredible therapist who I still see, most incredible dietitian who I haven't seen in many, many years. And she's long since retired and moved away. But even with such an incredible team, I felt very isolated in between those appointments. And that's the power of peer support, is being able to be that extra support. And I think the women in midlife that I work with virtually are from around the country and Canada. And just knowing that they have a place where they can connect with other people in their age range who understand some of the struggles. Obviously, everybody's situation is different. Their issues are different. Their journeys are different. There are different stages of recovery, but there's just something that they all get. And I think the same would go for any group specific support, not
Finding
just
your
women in
community, right?
midlife. Yeah,
Find your people.
exactly.
And there could be more of it. I mean, Betsy's doing it, but there could be, other organizations that start, and particularly somebody who's recovered, who feels like they're getting enough support in the community, so that it doesn't have to be a high fee. It doesn't have to be, if they don't have insurance, it just can be a little bit scary. So it's like,
And reducing the shame so
Yeah.
they don't feel like, something's wrong with them. They're battling a disease that's not their fault, and they deserve support and connection.
Before we open up to questions, what nugget would you like to leave folks with?
Well, I've done this before, and I will tell you the very last line of my book, and it's on stickers there that you can take with you. The last line of my book is, it's never too late to be work in progress. Those are my words. It's my quote. What I mean by that is it's never too late, obviously, to recover from an eating disorder. But the second part of that is even more important. And that is, and it goes to what I was talking about, the FDR quote, we're always all a work in progress. We can always all become healthier in mind, body, and spirit. My recovery was life-changing. It was transformative. It undid so many things that were ingrained in me from a very young age. And the word now that comes to mind is freedom. So I just encourage anyone who's struggling at any age and the people who love and support them to keep fighting. That recovery is possible and it looks different for everybody, but we're always all a work in progress. There's no finish line.
I love that. I think that my little nugget is that we need not to just look at uh, recovery as kind of food body. It's really trying to, I said, what do we want to shift about your life? It might be that the food and body stuff is the last thing, but let's start so that you can have um, a more embodied experience in this life of yours. Um, and it could be, getting a bird feeder out your window and looking at birds. I don't care what it is, but I think sometimes we focus too much on the outcome. And then, to be honest with you, as therapists, we then feel like we're a failure. It's like, or what else what could I do for this person? They've had an eating disorder for 30 years or 40 years or whatever it is. It's like, whoa, 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 like we can do a lot if you're just not focusing just on that.
Mhm. I think it's that joy of discovery of who
Yeah.
you are beyond your eating disorder can be very scary for someone who's struggled for decades and can't envision a life without it. And it terrifies them to think of a different identity than the person who has the eating disorder. But looking at that as just the joy of discovery. And it's okay even if you don't have all the answers. Just it's a process.
I hold on to an experience I had after my recovery when I went snorkeling. And I just I it stays in my mind all the time. I think I just love seeing I loved it. And I knew that if I had been struggling, I would have been like, oh my God, how do I look at my bathing suit? What am I, and it stays with me so many years later. So that's what I think we're trying to do is have somebody have an experience where they can just be present
Present.
and see a joy in anything.
Simple pleasures.
Yeah.
That you can't enjoy when your brain is just consumed by thoughts about food or exercise.
It can be 1 second.
Yeah.
We're not talking about like a forever thing. We're not talking about even 5 or 10 minutes. It
Yeah.
could be like 1 minute. Okay. Whew. Okay. That's good. So
I love that so much. Let's open it up to questions. So folks online, if you have questions, if you want to drop them in the chat, I can grab them. And anyone in person as well.
I have a question. First of all, thank you. It was really, really wonderful to hear from both of you. Do we have any idea of prevalence rates?
I think the percentage is pretty high. Isn't it 50% show some signs of eating disorders? But I think
50 to 70%
of
have
midlife.
one eating disorder
Right.
symptom.
But so many go undiagnosed or never diagnosed because so many, like I myself, when I was diagnosed, like, how could I possibly have an eating disorder? So there's so many people out there that would have a clinically diagnosable eating disorder, but they never get diagnosed. So it's really hard to know the true numbers.
Yeah, I mean, I'm just even thinking of like completely understanding the patient. If 50% are diagnosed, I
Yeah.
mean, that's
Look around at the people even in your workplace, not
well,
but I'm serious, like, who do you can kind of feel it sometimes when you're with other people. And many of those people are not getting treatment. They just are living their lives. So I was looking up stats before I came, like, they're all over the place. But I think that it is not diagnosed with younger people. I think it is getting diagnosed and because they're getting some treatment, but I think this population is not being diagnosed. And partly it's because they might not know it, but some people just don't want to be diagnosed and don't believe that anything can change. So
Someone
one of the things, I'm also a clinician. No, I don't specialize in eating disorders, but I've recently seen a couple of cases where eating disorder was never part of our treatment, and then they start to get physically sick. The next thing you know, it is, raging. And the one woman I'm thinking about is in her 60s.
Yeah.
And the trauma just, the body starts to fail, the trauma gets reignited, and then the eating disorder is coming right in the front door.
And trauma's a biggie.
Trauma's a biggie, yeah.
That people hold on to their trauma and until something comes up,
Yeah.
like
Yeah.
a death or, more trauma. And it's like, why would I want to open that floodgate?
I didn't learn until my recovery that trauma could be emotional. I carried so much trauma with me for decades, but I didn't think it was trauma because it wasn't physical.
Do you folks have thoughts on access to eating disorder care for like Medicaid, Medicare folks? It's really challenging
Major
to get
issue.
access. Medicare doesn't cover dietitians. Medicaid doesn't actually either. And it's very challenging to find therapists who accept Medicaid or Medicare. Do you have thoughts for those folks?
Takes a lot of legwork. I just found a dietitian locally in Rhode Island for a woman on Medicare actually who couldn't get coverage, and the dietitian is willing to see her with a significant sliding scale.
Yeah.
So finding clinicians out there who are willing to do that, but it's such a barrier to treatment.
And the other thing I would say is find somebody that takes it that might not specialize in eating disorders and then access other resources like Meta, to supplement because and just be careful that you're not expecting that therapist to understand. And the other thing that therapists can do if they're willing, if they, don't know a lot, is they can get consultation.
If they're a professional member with Meta, they automatically have a consultation group that they can be part of as well. So if you know folks that have Medicaid, Medicare, and they are working with a dietitian or a therapist who doesn't specialize, you can mention the fact that they can get that here.
Right.
Actually,
Right.
very affordable.
But you try to put a package together. I mean, it's not fun and it's not, it's not easy at all.
Folks are also wondering if you might address how recovery for binging versus undereating is different. Is it best to be in a group with those with eating disorders or with the same eating disorder, or does it matter?
I'll answer that. I'd say I've seen all types of eating disorders in my group, and I've had some women reticent to join a group who suffer from binge eating, assuming everybody there is going to be in a smaller body and struggling with anorexia. And what I always say, and a group is a group, you have to try it to see if it's the right fit. I always recommend giving it 2 weeks, not one. You can't judge anything by one time. But I think the key is no matter what the behavior is, those are the symptoms. So whether someone's binging, restricting, whatever, it's what's underneath that's driving those behaviors. So even if you're struggling with different eating disorders, it's the behaviors underneath that are driving those symptoms. So yes, I think it's very helpful if you're, suffering from binge eating disorder to talk to people who understand that particular eating disorder and illness. But it doesn't mean they're not going to also benefit from being in a group with people with the other eating disorders.
And I think the job of the people in the group is to look at their judgmental parts about that person must not understand what I'm going through. And I understandably, it might be, everybody has different experiences, but that's like saying two people with binge eating disorder have the same experience.
Right.
No.
And the eating disorder changes over time.
Yeah.
Someone could be severely restrictive anorexia, and then next thing you know, they're binge. So
I think it's a piece of work in the group to be done.
I'm going to toss in, though, for just educational purposes for folks, that all eating disorders are restrictive by nature, right? So folks who are binging and folks who have bulimia typically are restricting in between. So that goes across all diagnostic categories. So there's that restriction that needs to be addressed for everyone. So sometimes I worry a little bit when we do the this versus that disorder when we are struggling with category do the lead thing, right? Like,
And because I'm a clinician, trauma has no place, discussion of trauma has no place in my groups, but we can also talk about what purpose our eating disorder serves, whether whatever behavior it is, what purpose is it serving? How and why did it develop? We can't go into the details because it's not a clinical group. But we can also talk whether it's binging, restricting, whatever it is, how did it develop and why without going into the details. What purpose is it serving in the present now? Whether it's helping you feel in control or reduce anxiety or numb emotions. So there's commonalities no matter what the behavior is.
someone was wondering also if you could delineate for them the difference between peer support and coaching.
Oh, that's a great question. I think coaching is something that in recent years has taken on a huge place in the eating disorder space. There's certification courses for it. People can open up a coaching practice. I think coaching is very practical oriented, whether it's meal support or working on specific things that the clinician may recommend you work on, and having the coach think about what a coach does in sport. They help you with skills. I've done a lot of mentoring in the past, one-on-one mentoring through nonprofits like ANID and also on my own. And I prefer to look at what I do. Have I sat with people for meal support? Yes. Have I helped people shop? Yes. But I look at mentorship, and there are definitely commonalities with coaching. But again, it's more that person who gets it that you can reach out to. And it doesn't have to be a specific thing. It can be just, I'm having a really hard day. I'm struggling. I need some extra encouragement. It's not necessarily like, I can't follow my meal plan. Can you have lunch with me or whatever? So I think there's definitely a lot of overlap. People have asked me, like, are you going to become a certified coach? And, I did think about it before my book came out, but I love mentoring. I love my peer support groups. So peer support, it just means that it is non-clinical, non-therapeutic support. It's extra support between that. Whereas I think a coach can be a very, very helpful part of the team. But I'd also like to think a mentor or peer group can also be an important part of the team. It's just recovery. Coaches, it's become more formalized because of the certification, but I think you could function as a coach without certification. It really depends what you're. Some of the things I've done for people would come under the category things a coach does. But I think of myself more as a mentor and peer support group leader.
I know we ran a couple minutes over, so I just wanted to thank folks for hanging in there for that. And if folks have other questions, if you're here in person, I'm sure Betsy and Beth would be more than happy to answer. And if we missed anything online, please feel free to send questions to info@metainc.org, and we will get the answers back to you as soon as possible. So thank you.
Thank you.
Beth and
Thank you all for coming with me today.